distress in adult sickle cell disease patients in Africa, sharing experiences, building resilience, and a call to action. My name is Kambe Banda, and I am a research fellow with SickleInAfrica Data Coordinating Center, and my co-moderator is Jean-Pierre Walia, the host of Pain Free Podcast in Zambia. We are very delighted to have you here. Thank you for making time to join us, and we thank the patient as partners in Sickle Cell Disease Research Working Group and the SickleInAfrica Consortium for the joint organization of this webinar. The SickleInAfrica Data Coordinating Center, SADC, for hosting the webinar, as well as to our distinguished speakers. We can't wait to hear the stories and your call to action. To provide some background, SickleInAfrica is a research consortium that aims to establish an African sickle cell disease registry, and with the ambitious goal of enrolling approximately 30,000 individuals with sickle cell disease into the registry. The consortium is currently running an implementation science study on newborn screening for sickle cell disease in Africa. Presently, SickleInAfrica operates across Ghana, Mali, Nigeria, Tanzania, Uganda, Zambia, and Zimbabwe, with its clinical coordinating center based in Tanzania, and the Data Coordinating Center, SADC, is housed at the University of Cape Town in South Africa. SickleInAfrica is generously funded by the National Heart, Lung, and Blood Institute of the United States, NIH, which is the National Institutes of Health. Central to SickleInAfrica's mission is the imperative of patient engagement, and thus we collaborate very closely with sickle cell disease patient representatives. The Patients as Partners in Research Working Group boasts representatives from 14 different African countries. In today's webinar, we will listen to personal experiences of mental health and psychosocial distress among adults living with sickle cell disease. We'll explore coping mechanisms, including counseling and resilience strategies, and engage in discussions on various non-pharmaceutical approaches for managing psychosocial distress and sickle cell disease. The goal is to discuss psychosocial strategies for improving the quality of life for persons living with sickle cell disease. Throughout this webinar, we encourage you to utilize the chat box to share personal experiences or those of loved ones regarding psychosocial distress and sickle cell disease, which is often something ignored. We welcome suggestions on approaches to minimize or cope with distress, and will provide opportunities for participants to contribute via raising their hands. Today, we have 4 speakers, and my co-moderator, Jean-Pierre, will introduce our first speaker.
Thank you, Kambe, for that. My name is Jean-Pierre, and I'll just like to thank everyone for being here. Our first speaker today is Mr. Joshua Donmoye, who brings a wealth of experience as a mental health practitioner specializing in substance abuse intervention, research, counseling, and psychology. Currently providing mental health services for sickle cell disease patients at the University of Abuja, Nigeria. Mr. Joshua will briefly present on the impact of psychological distress on the quality of life of adult sickle cell disease patients in Africa. Mr. Joshua, the floor is yours.
All right, thank you very much. Good morning, good afternoon, and good evening, as she said earlier. It's Joshua Donmoye, by the way. I'll be presenting on the impact of psychological distress on the quality of life of adult sickle cell patients in Africa, Nigeria to be precise. Next slide, please. A brief introduction into what sickle cell disease is. Sickle cell disease is a group of inherited red blood cell disorders that affect hemoglobin, the protein that carries oxygen through the body normally. Red blood cells are disc-shaped and flexible enough to move easily through the body, through the blood vessels, sorry. In sickle cell disease, red blood cells become crescent, that's sickle-shaped, or sickle-shaped due to the genetic mutation. This sickled red blood cells do not bend or move easily and can block blood flow to the rest of the body. The blood flow through the body can lead to serious problems, including stroke, infections, and episode of pain crisis. Next slide, please. Sickle cell disease, or SCD, as it's commonly called, is a significant health concern for specific ethnic groups, including but not limited to Africans. It causes not just physical health problems, but mental health problems. not just for the sickle cell disease patient, but also the caregivers. It takes a toll on their mental health also. Individuals with sickle cell disease may experience psychological disorders such as anxiety, depression, PTSD. And the PTSD can be in two forms, which is CPTSD and PTSD. Now, what causes psychological distress in people with, my slides are gone. Excuse me, my slides are gone.
Joshua, just give us a moment to that.
Okay, thank you. Before I stop, what causes psychological distress in people with sickle cell disease? The chronic pain, fatigue, sleep disturbance associated with sickle cell disease contributes to the development of depression and anxiety. There's literature supporting that. Factors as low income, lack of social support, and difficulties navigating the healthcare system can also contribute to depression and anxiety in individuals with sickle cell disease. Like Nigeria, for example, when individuals try to get healthcare, there's long lines, there's all of that. Although this person is already in distress, it causes more distress. The burden of finances, oh, where would I get money to go for my next appointment? That also takes a toll on the person. Social support. Some families are like, oh, why would you, this child, you know, in the African world, there's this child is not my child because of he has this and this. Families themselves begin to stigmatize people. Even in schools, you see people not trying to associate or relate with people. It extends down to their relationships even, and this can take a very heavy toll on the individual's mental health, causing depression and anxiety. Individuals with sickle cell disease are at risk of developing PTSD also, oftentimes as a result of traumatic events related to the illness, as pain crises, being hospitalized, and medical complications. You know, if you've experienced something close to near-death experience, some individuals who have had pain crises and have been admitted, and I can't imagine the pain. The way they explain the pain, it's something that is heavy to think about. Next slide. Now, health-related quality of life. Health-related quality of life refers to the impact of health status on an individual's physical, emotional, and social well-being. Health-related quality of life, this is a broad concept and encompasses the aforementioned, yes, but it goes beyond just the presence or absence of disease. It's important as it provides an overall insight into how a person's health condition affects their overall well-being. Okay. In general context, I am sick, yes. I have an illness, yes. I have an ongoing condition, yes. But am I getting social support? Am I getting mental health assistance? And personally, I feel like taking a holistic approach into healthcare in Africa would go a long way in helping everyone and sickle cell disease patients. Now, understanding and addressing psychological aspects of sickle cell disease is crucial for providing holistic care for patients and improving their overall well-being. The question now is, modern society, is characterized by advancements in science, technology, or better opportunity than our ancestors. But why then? Why then are we more distressed? It's simple. Many modern people live life with only minimal contact with family and friends in a real sense, because oftentimes, though we are more connected because of social media and all of that, there's a bridge between real connections with individuals. And as a common saying, modern society brings up new opportunities but comes with its own problems. And those problems directly impact our mental health. Oftentimes, there's overstimulation due to social media and social engagement. Next slide, please. I would like to talk about experience of my case studies with one of my clients, protecting the person's name and gender and all of that. The client with sickle disease was worried about getting a life partner because of, well, being that you're a sickle cell disease patient or warrior, was worried about the fact that, okay, they wouldn't be able to get a partner to build a meaningful relationship with and have children. Well, we followed an intervention process where we explored the underlying issues of fear, which was somehow leading to levels of anxiety. We challenged negative beliefs about self and then explored methods of coping with the anxiety, such as rhythmic breathing, writing down problems and highlighting the ones that, okay, yeah, we can solve these ones, yeah, and the ones that we know we can't solve directly, and following up. We then identified what can be changed and what cannot be changed. You know, it's one thing to have sickle cell disease, yes, but it's another thing to have a mindset of how to cope with the said disease. We use talk therapy as a means of relieving negative emotions. I tell people a lot, catharsis is a very important thing. It's good to talk to people. It might not necessarily be a mental health professional, but someone you can confide in, tell your problems. It creates a level of relief to the problem. Next slide, please. So what next? How do we help individuals with sickle cell disease cope psychologically? First of all, we provide psychological services. I feel like psychological services should be incorporated into healthcare in Africa, precisely. It's not something that is really heavy, like Nigeria, for example. It's not something that is really followed up on or heavily prioritized. But an holistic approach to health would help the person recover faster even. Couples counseling should be provided for sickle cell disease patients and their spouses. Now, like I said, the disease not only takes a toll on the mental health of not only the patient, but also the caregiver. Now, the caregiver extends down to the spouse. Psychological services provided to caregivers of SCD patients relates to the last point I just spoke about. Group support, like here in Chester, we have a group chat. That's the Center of Excellence for Sickle Cell Research and Training, University of Abuja. We have a group chat where the sickle cell disease warriors interact, share experiences, how they cope with things. Yeah, that's good. Group support is very important. Doctors should provide some form of counseling, even though there are professionals for this. I feel like if your doctor actually shows a level of concern and, you know, has a conversation with you on how to better cope with the disease on a psychological level, it goes a long way. And if they can't really provide much help, they can also refer you to other mental health professionals, psychologists, psychiatrists, and a lot, counselors even. Next slide, please. Question and answers. Is there any questions? We'll take them towards the end. Thank you. If you have any questions, you can drop them in the chat. I would respond to them towards the end.
Thank you, Mr. Joshua, for that well-delivered presentation. It's one thing to have sickle cell, but it's another to have the mindset to deal with the disease. And I think that really stood out, not just for me, but for a lot of people who have sickle cell and who are familiar with what happens in the sickle cell community. So at this point, I'll call upon my co-host Kambe to introduce our next speaker. Kambe?
Our second speaker is Mr. Aliu Badara Sambu. Aliu wears many hats. He is the president of the Sickle Cell Association in Banjul, the Gambia, interim vice president of Umoja Sickle Cell Consortium, director of academics at Dae Njoro Skills Academy in Brusubi, and a passionate social and political activist. He is a sickle cell warrior and rare disease advocate. Aliu will share his struggles with mental health and psychosocial distress living with sickle cell disease, along with his coping strategies. The floor is yours, Aliu.
Thank you very much, Kande. Is it okay to put my video on, or is it okay to speak like that?
It's up to you. You can show us your face so we see what you look like. It's up to you.
Hi, thank you. Okay. Welcome, everybody. Like they said, my name is Ali, warrior, patient advocate. Yes, thank you. First of all, I just want to look at the topic psychological depression in adults with sickle cell. Next slide, please. Next slide. Okay. I try to be very creative in presenting some of these things. It says depression simply refers to persistent feeling and of sadness and loss of interest. Next slide. Next slide. Thank you. Yes. Yes. I tried to use this. I start to color the feelings, some of these words in different colors, red, showing sign of depression and stress. I'm having trouble getting so many intervals with this views. Sorry, I don't know. Oh, sorry. Admin, can you please help this? Yeah, okay, thank you. The mind, persistence, feelings, sadness, behavior, and then also interest. So these are three words that I will just want to explain a little bit. Now, generally, the mind controls the whole body, and as sickle cell warriors, like they just presented, just said, psychologically, we go through so many stresses. Having sickle cell itself is something else. Talk less of having anxiety and sad emotions that persist, that keeps on coming your way every day as a warrior. So with these things, it makes life very difficult, and sometimes it leads you to the point of wanting to quit and then not having interest in anything with regards to living. I just want to share one story of mine. Once upon a time, 15 years ago, after graduating from high school, completing my college, and was about to start my life, and then walk into my journey as an adult growing. I felt sick for almost a year, and then during this time, there was this day that I woke up in the morning and I was having anemia. I told my mom. It was just the day before when I was released at the hospital. So during that day, I look at myself and I see that I was pale, and I felt that I was anemic. So I told one of my family members that I needed to go back to the hospital. So, and then I asked for her to call my mom. Then suddenly I felt a little bit sleep, and in that sleep I had a word. I had something, someone whispering in my ears, "You disturbing, you annoying, you just disturbing. I think you should die and let it be." From that moment, I had a very, very, very shocking feeling, and all I prayed for at that time was just to die. I nearly passed away. I went into coma, and then almost 3 days I didn't know where I was because of that sad feeling that I had, because of that sad um, mental trauma that I had. It was really shocking as someone, with so much dreams, being sick, and then to a point that you felt that you were a liability to your family, and you were disturbing people to the point that they even wanted you to die. So I decided to give up, and then just went into coma. I never knew what happened, because in my heart, all that I paid for was to die at that moment, because that was how I, wanted to. I was feeling, rather, because if I look at all the consequences that I've been causing my family for almost a year, I couldn't move, I couldn't do anything for myself. It was really difficult. And my mom was not in good shape. Was not in good shape. She was pregnant, and then I was disturbing her for almost a year. There was nothing I could do for myself. So hearing that kind of thing really made me give up. And when I did that, I went into coma. And when I woke up from the coma, I felt bad for coming back. But praise be to Lord, to the Lord. I never regretted coming back, because it was after then that I became who I am today. It was from there on I knew that I was living for a reason, and there was a reason why God didn't take me. So from there on, I started doing research. I started networking. I started studying people, because in my lineage, I was the only one that was diagnosed with sickle cell at the age of 3. So there was nobody or no one who understands my feeling. And then growing up was very difficult, because I didn't have anybody who understands how much I was feeling. There was no one in my family who was ever felt that. So it was really difficult growing up. And then after growing up, going through so many challenges, passing through so many challenges, going up to high school, finishing high school, going to college, having my first certificate, thinking of starting life, and then building up a relationship to start a family, and then suddenly this thing came up. But actually, as I came back from the coma, I was really blessed. After 2 years, I came across the Gambia Sickle Cell Association, and this was the first time I've ever met people living with sickle cell. In my entire life, I thought that I was an outcast. I just came from nowhere, and then dropped into a family, and I was creating lots of problems for my family. It was really difficult. It was really difficult for me. I felt that I was a burden on my family, so it was really hard for me to accept. But when I met this family group, and I saw some of my colleagues, having the same illnesses like I was, so I felt grieved, and at least that was the first time I felt so relieved that I started to believe that it was not me. So behold, there were people who were also, just like me. So from there on, I started to do research, go online, try to find out what sickle cell was all about, try to find out who people are who are there that can really help, and then get more information about myself. And then I started sharing this information with that group, and then I started to impact so many people. They started listening, because we were just a group of warriors not knowing what to do, and then living in different families sectors. So from there on, I took up the leadership to share whatever information. So this is what inspired me, and then I then started to feel grateful for everything that happened to me, because if that didn't happen, then obviously I would just commit suicide, because I nearly took my life. All I wanted to do during that time was just to die. These are feelings that people have, and then the discrimination, the stigma, the misconception all around sickle cell made life very difficult. Now, as an adult, also, it's another challenge, and then um, imagine growing up, being able to do so many things, and then you want to start up a life, and there's nobody who wants to settle down with you. This is another big psychological depression that people with sickle cell live with. But For me, as a warrior, I believe that everything happens for a reason. Because from my experience, I believe that everything happens for a reason, and because quitters are those winners are those who never quit. So as I tried to quit, then something came up. So this is what keeps me going. And then luckily, I also had the chance to go through a coaching session, which has really impacted my life and has changed my life upside down. It has made life very, very, very interesting. And then it has really, really, really cured my depression and give me the courage and the confidence and self-esteem to even live more. Without all the things that I yearn for, I am still grateful for everything. And I am also very, very fortunate and also very privileged to meet people like me across the globe, across the continent, who has the same passion like I do, and then also want to help save lives. So I believe we were created for a mission, and then we are not just sickle cell warriors just because we choose to. We were destined to be. So I believe with this destination, we are also supposed to have a legacy. We're supposed to, empower, inspire people to live. I know some people find it very difficult to live with such conditions, especially psychologically, when you're going through so many, persistent emotions that are always keeping you down, making you lose interest. It's very difficult to live. I know it's challenging. I have been through it. I'm still living it, but I'm still grateful for everything that I have. Thanks to my coach who really helped me, and then she really turned my life upside all around, because before I was just a procrastinator who fears a lot, and then now I am somebody who fears no more. And then I don't procrastinate. Whatever comes to my mind, whatever pleases me is what I do. Whatever I think will make me happy, I just go into it. Whatever happens, I just take it in good faith and know that I have a reason for living, and I have to live my days. And every day I have to make it as cheerful as possible, as if it's my last day to live. So this has made me. This has impacted me greatly. And then these are some of the things that I want to share with the outside world. I know it's very difficult, but nothing happens for no reason. So it's not only sickle cell patients who go through psychological depressions. We have people across the world. We have people everywhere who are suffering from so many chronic illnesses, but yet still they live. So imagine life without support groups. Imagine life without people like us. Imagine life without loved ones. Imagine life without difficulties. Imagine life without challenges. How would you learn? How would you grow? So I believe with all these challenges, with all these difficulties, it's just it's just coming to teach us something in life that will make us a better person, and then also make us accept everything that happens to us, and then to also live a happy life, because nothing happens for no reason. And we are very grateful. Like we always say in the Gambia, sickle cell is not a curse, but it's a blessing. Sickle cell warriors are beautiful people in the world, and one of the most charming people that you've ever met. Despite the most caring people in the world, I could say, because we know what pain is. So definitely, whenever we're suffering from pain, definitely know how it feels, and we definitely give much care. So these are just simple things, few things that I wanted to share. Thank you all for listening. If you have any questions, just drop in the chat box, and then we'll get you answers later. Thank you.
Thank you so much, Ali, for sharing your experiences, especially how persistent feelings led you to feel like you wanted to quit. And thank you for sharing your story. I know that so many of us on this webinar, not just the warriors, but even some of us, whether it's health professionals, caregivers, or people just interested to learn more, can draw inspiration from that. And also, I think one of the biggest highlights from your talk is the importance of the community that support groups provide. And we're hoping to hear more about that when we have questions. There are some questions in our group, in the group chat, and we see that. We'll keep those for the end. So now for our third speaker, over to you, Jean-Pierre.
Thank you, Kambe. So our next speaker is Dr. Samuel Ivanboard. Dr. Sam will share his personal journey of dealing with psychosocial distress while living with sickle cell disease, how these challenges have impacted his studies and quality of life, as well as the coping mechanisms he employed. Dr. Sam, thank you for being here. The floor is yours.
Thank you so much for the opportunity to share, and thank you for all the support. I see so many familiar names and faces, so I do appreciate you guys coming out to help. And yeah, so I was diagnosed pretty late compared to everyone else. I was diagnosed at 14 years old, and it happened after a teacher came in smelling like smoke, and that was asthma. And life was just, from then on, went downwards. I had to stop a lot of sports and activities, and I then had this identity. I was very small. I was still very short back then. Had this identity of being a frail, weak person, and I couldn't compete with my peers who were bigger, more rough. And so that identity was in my head that, hey, I am the weaker person, in everywhere I went. And it was made worse by having my dad have to go on regular Mondays to hospital and waiting queues for medication because we couldn't afford the medication. And I just felt like my existence was bothersome to people around me. And that took a toll, and I carried that for a long time, and it made me very, very hungry for validation. I would be over eager to show my worth to people, and I'll be crushed when they didn't appreciate it. And it was always this back and forth, because I didn't give that validation to myself, and I didn't get it from God. And that continued until 4th year when I was admitted in hospital for blood clots. And my life flashed before my eyes, when I couldn't breathe on the oxygen mask. And I cried and cried and cried. And I'm like, why am I crying? And I could see the painful tears on my oxygen mask. And I had all these emotions of 22 years of regret coming towards me. I remembered all the goals I set for myself, everything I said I'm going to do, but I didn't do because I was too tired, or I was in pain, or I was sick, or I didn't feel like it, or I was under pressure, or I had the existential dread. And all these things came to me, and I realized that I'm gonna die, at 22 years old, and leave all my goals just hanging, and thankfully I got better, but it really made me think about the transitionary period of life and how short it actually is. And so in the hospital, they gave me so much bad news, like, hey, you have dilated cardiomyopathy, you have the blood clots in your lungs, hypertension, aortic regurg, all this stuff. I'm like, this is overwhelming. And so I wrote a journal entry and I called it, see, the name is of the journal entry, The Life of a 50-Year-Old Warrior, okay? Because I assumed that, let's say I have 28 more years of my life, how am I going to live this? And I decided that I'd rather live 28 more years, so till 50, and live with no regrets, than live to 100 and have, suboptimal life and have all those regrets. And so I realized I'll always be tired, I'll always be in pain, and it'll be very rare for me to have everything aligned for me to pursue my goals, pursue my dreams. And so I had this quote, this motto that said, do it tired, do it sick. And it helped a lot. And it was painful initially, especially with the blood clots. After leaving hospital, I couldn't do anything. I couldn't stand long enough in the shower. I had to kneel over in 5 minutes. I had to sit down to use the toilet because I couldn't have the stamina. And I would go in and out of excuses, even though I made a decision in my mind that, hey, I'm going to become a rock. I still had that self-pity for 5 months. But then on the 1st of Jan, I said, my New Year's resolution is to, see how far I can get this. And so for the first 4 months, I trained 3 months. I trained 3 times a day, almost every single day, because I would pass out during workouts, and I would fall asleep on the grass or fall asleep on the towels because I didn't have the stamina for it. And over time, I was able to gym for 30 minutes in a row, 1 hour in a row, 2 hours in a row, and now I actually train like a normal person. And I could look at myself in the mirror and I thank God. I'm like, this is, the reckless hard work of a younger version of myself who really decided that, hey, I'm going to put this above how I currently feel. And for a lot of my medical career as well as a doctor, when I was studying, I treated patients that were much, much healthier than me. And funny story, there's one time that I got sick. I had a crisis of the obs and gynae call, and I had missed quite a few days of school. And so to catch up on that, I had 4 calls for obs and gynae in 7 days, which is ridiculous. You have the thing that made you sick, you do 4 of those in 1 week. But did those, I got sick again. I failed my test on a Friday, but obviously, because I couldn't study. But then studied that, later test for the exam, did well, God saw me through, and it's just been amazing. And sickle cell anemia, while it would have been a curse, I've realized that's how I see it. And it's given me evidence of who I am, that I'm not the type of person that shrinks away from challenges, that I get to be the hero in my own story. I get to see every obstacle as a way to create more proof, of who I am. And so I have 3 things that I want to share with everyone here that have really been pivotal to my mindset, okay? And number 1, it's identify who you want to be, okay? So if you break down your life into your relationships and your physical health and your spiritual health and your emotional health and your mental health and your career and your finances, write down who you want to be in all those domains, okay? And what has helped me a lot is I write down actions I've taken that are in line with what I'm going to do. So for example, I'm going to use physical, being able to train off the course or being away for 32 hours and still going to the gym, which is reckless, but it's 45 my mind that, hey, I'm that type of person. Or, being under pressure and being stressed and calling my family, being like, I need to call them, I haven't called them in a while. It's important. Doing actions like that reinforce who you are, and it gives you momentum. It helps you have that proof that you are who you say you are. Number 2 is that emotions are fickle. There are many times I've overcome challenges feeling suicidal, that you don't necessarily have to feel A-okay or feel, ecstatic to overcome challenges. Many of the situations you go through in life and difficult challenges you go through in life, you won't feel like going through them. You're going to feel iffy. You're going to run away from those situations. And I've just learned that the same person that spends too long looking outside a glass window, should just, jump. I know it's pretty dark, but that same person the next day could be seeing patients, laughing with the nurses, high-fiving colleagues. And it's just that's the duality of, how things are, that emotions are truly fickle. But at the same time, as fickle as they are, I don't think they're irrational, okay? I do believe that your emotions are a perfect response to how you see the world. And so what's wrong is your perspective and not really the, emotion. Sickle cell anemia can be seen as a death sentence, and you could go through life feeling sorry for yourself and, always wanting to shrink away from challenges. Or you could, see it as an opportunity to prove to yourself every single day that you are tougher than you thought you were the previous day, which I've done. That's been beautiful. And number 3 is hope. You need hope because hope allows you to try. And I love the word of God because God believes in you so much. I read the Bible, I'm like, God believes in me more than I believe in myself. And for the majority of my life, I've had my family members believe in me more than I believed in myself, through medical school, through every single thing. And only recently have I started believing in myself more than they believe in me. But that hope allows you to try, allows you to fail and try and fail and try and give you something your best and sweat for it, fail at it and try again. And you need that hope to continue to keep you going. And last thing, I have a quote and it says that life is like swimming. If you can't swim, you're going to hate swimming, okay? If you can't swim, you're going to drown. So you kind of need to be able to, swim for you to actually enjoy swimming. And that's the same thing with life, is life gets easier the more of it you live. Because you get stronger, you get better at living. And so if you feel very disheartened right now, just understand that if you, stay alive a bit longer, you push through a bit longer, you will build those tools, you will build those strategies that will keep you alive and help you to enjoy life a bit better. But that's basically it from my side. Thank you, guys.
Thank you so much, Sam. for bringing us into your world and your space and being so vulnerable in sharing your story, allowing us to sort of peek into the unexpected shift of reality that you faced quite late in life. The inner battles that we've all faced, and sometimes we find it hard to communicate. Really appreciate that. The last part about hope, which allows us to fail and try again, fail and try again. I mean, we all need hope to keep going. So thank you, Sam, for that. I will call my co-host, Kambe, to introduce our next speaker. We are receiving a lot of questions in the chat. Trust me, we are taking note of all the questions, and after the next speaker, we'll get into the Q&A. So please keep the questions coming and just hold on until we get into the segment, and you will have the answers from our speakers. Kambe, take it away.
Thanks, Jean-Pierre. Also to our speakers, there's a lot of words of encouragement. So please do also check the chat once you're done speaking, so you can see all the messages that are being written to you. And now for our last speaker, that is Clara Faye, a wellness and resilience coach. Clara will present cases demonstrating how resilience coaching has empowered individuals living with sickle cell disease and other chronic conditions to navigate distressing moments and situations. Clara, go ahead.
Thank you very much. I hope you hear me well.
Yes,
does
we
everyone
can.
hear me?
Yes, we can. Go ahead.
Oh, that's perfect. Okay. So I just share this screen. So if everyone can see, I will start.
Yes, we can see your slides and we can hear you perfectly.
Perfect. So I'm Clara Faye. I'm an emotional coach specialized in resilience, and I've been working a lot with patients living with sickle cell disease. So the thing that really is in the core of my work is that I observe consistently how sickle cell disease affects the physical, emotional, mental, and social life. So the full and the whole quality of life of people living with sickle cell is actually affected by this disease. And as a result, I understood that there is an emotional emergency underneath the physical emergency. And it was, and it is extremely concerning because I've noticed how isolated people with sickle cell are. I've noticed how it's a huge taboo to speak about the emotions, the struggle, and it's a hidden, like an iceberg, the emotional emergency. This is very often ignored. I've been working with people living with sickle cell in France. I've been working with people from Gambia, from Nigeria, from Niger, from Kenya, and so on. And with almost everyone I've noticed, I don't know why I said almost everyone, they feel ignored. They feel like they can't express. And the problem with that is it adds up to this emergency to an extent that can create another tragedy. Because the fact that the emotional aspect is usually not really taken care of because it's invisible, it has a consequence that, unfortunately, living with a gift, some people can let themselves die, just not to be a burden anymore. And this is because of how overwhelming the emotions are and how isolated they are without sometimes any tool to handle and process those feelings. But fortunately, there is hope. And I think we are all connected here because most of us, we talked about how hopeful we can be. But feeling better, yes, feeling better can be learned. And this is, for me, my main hope. Because our thoughts, when the thoughts are involuntary, they can create involuntary feelings that can create involuntary action or inaction and involuntary results. You talked previously earlier about how overwhelmed and you are by despair after being isolated and having so much to handle with the disease. And the thoughts that appears at this moment involuntarily are thoughts that create despair. And this despair creates sometimes some action that can harm us. And the hope for me is that with working on your thoughts, or the other side is in French. Sorry. So this means thoughts. It's exactly the same. It's TEAR. You can create voluntary thoughts that can generate and change the emotion from despair to hope. And from this new feeling, you can start to breathe again, to act forwards, and to open yourself to life again with new kind of action, like expressing, for instance, like joining forces, like transforming your suffering in something constructive. And all of this comes when you feel that you can have a proactive approach of your inner world to change the direction of this energy. So mainly my work is about this. And now I'm working with two doctors, Dr. Vaudouet and Dr. Texer, about studying and working on a research to observe the impact of the emotional coaching on the quality of life of patients living with sickle cell disease. And the hope for this work is to be able to systemize the work, to be able to help more people and to understand why it's working and how. And to give you maybe an example, people living with sickle cell can be stuck sometimes for things that we don't imagine, like taking a plane ticket to, or taking a train ticket to go somewhere because of the fear of not being able to really show up the day of the meeting, for instance. Sometimes it's being stuck with passing the driving license. And sometimes it can be stuck on asking for help. And what can be the consequences when someone feels too guilty to ask for help when there is a physical crisis? It can become a tragedy. And this is why I deeply believe that everyone working to empower people to feel better and to use their inner strength with sickle cell are a great source of inspiration, and the inner work is also saving life. So this is mainly what I wanted to share with you, that there is a great hope.
Thank you so much for that, Clara. It's really important to get your insight. from your coaching experiences, what particularly struck me and that I liked was the term emotional emergency. You know, sometimes as I speak from the perspective of a clinician, is that when you see the patient, you often look for the physical emergency and not so much the emotional or the mental. And that's
Exactly.
something that we all have to make sure that we keep in mind as we encounter our warriors, and not just focus so much on that, because then in the end we go to your next point, which was what the warriors then start to feel ignored. And pain is a real sensation. Unfortunately, pain is something that we cannot see. And another thing that you brought up that I think is interesting as well, or that I've never really thought about like that, is the fear of things, everyday activities that we take for granted. You know, you are able to plan to go to a meeting next week or to take a flight, and, you know, you're not going to maybe have a crisis that's not going to allow you to go. And also, if you do, you know, for reasons, because these are lifelong diagnoses, so you feel afraid to tell someone or to ask for help, whereas somebody else might just be able to, you know, you take it for granted. I have a headache. I'm sorry, I have a headache. Can you help me carry my bag or something? Our warriors might not feel that as well. And thank you for bringing that up.
You're very welcome. It's extremely true. And sometimes it's can create this feeling of being paralyzed. And what I really feel grateful for when I work with people living with sickle cell is how inspiring they are for me as a human being, because the strength that they have, the fact that they live with this pain and that they go through life in a way that much of the human being don't even fathom. It's create also so many lessons and so many, I would say, wisdom and power that they have, that actually I believe that they have a great light to add to this world. And paradoxically, so much of them feels the opposites because of this pain. But this is also why they have so much to offer, and we shouldn't take for granted, and we shouldn't also ignore this power that is behind this resilience that they have, and we should just join the forces to help them to bring this power to light.
And this further emphasizes the importance of discussions like this, right? So thank you again so much, Clara. We appreciate you. There's a few questions in the chat. I'm just going to go to the first one to the top and read it, and then perhaps one of our panelists can answer it. The first question is from Emanuela Quintola. She said, well, I have a question. My question is, so what advice or what psychological advice can health professionals give to sickle cell patients? So we will... Oh, well, yes, you're well versed. You're perfect to answer the question. Yes, go ahead.
So the advice depends on the challenge. But the advice that will be universal is to speak, but not to speak to anyone. That's something that can be maybe controversial, what I'm about to say, but not everyone can help. Sometimes we want to talk and we need to talk, but we might talk to someone that doesn't have the capability to help. So the main thing is talk to a person that is specialized or very well conversant on the challenge that you want to be helped with. I cannot go further because I don't know more about what you want help with. But the main thing is talk to people that literally have an expertise in the area that you need help from. And so many times we are very disappointed in our family members, sometimes on our friends, because they don't have the capability and they cannot help us. So just break the taboo and find someone that have the expertise. On the internet is easy. If it's a coach, an emotional coach specialized in sickle cell disease, you can contact me, of course. But if it's a therapist or if it's a counselor, just focus on the area of expertise. That's the main advice. But don't keep it for yourself.
Thank you so much for that response, Clara. There was another question right after that I think you'd also be well-versed to answer is, hold on, let me find it. The question is from Molin Chima. My question is, what advice would you give to a sickle cell warrior experiencing discrimination at work?
That's a very good one. That's a very, very good one. Actually, this is a common challenge of facing sickle cell at work. So the first thing I will say is to acknowledge that whatever you're going through right now, you're not alone, because you're not alone going through this challenge. And I will say that when there is these challenges, there is different part of the problem. There is an aspect of being oppressed, and there is the aspect of feeling oppressed. I know it seems like it's the same. It's not the same. Sometimes we are being oppressed, but we can feel more or less oppressed depending on our support system. If we can work on this challenge and if we can literally work on the emotional aspects. So just determine, how can you find a support system? How can you find emotional support? Can you extract you from this situation without putting you in a bigger trouble, let's say? And just, yes, the support is very key. And the outside world, we don't have the power over someone, something. So just make sure to power on what you don't have power on. And on the things that you have power on, just take a step back, go with your support system, create a strategy, but don't stay alone, and keep being supported, because you can go through that. You're not alone. I can see that Ali also have an answer.
Yes, I was going to say, Ali has his hand up. Would you like to add something, Ali?
Yes, yes, I just wanted to add something to what Clara was saying. In my own way of, dealing with discrimination is just to be positive. As a patient living with sickle cell, for the fact that I don't procrastinate anymore, it makes me free from all kinds of negative thoughts. So everything that I see, I just try to reverse it in the positive way, and then try to learn from it, and try to ask myself, why is this thing happening, and then what can I do to reverse it? So basically what I do is just to be positive. Being positive is something that can really help, and then change your lives, and then help you to overcome all this kind of situations. So basically staying positive, it's something that makes things easier, especially when you're facing discrimination and all those things. Thank you.
Thank you so much for your addition, Aliou. We have a next question, and that is from Matakala. I have a niece who has the sickle cell disease, and she has been in and out of the hospital. This has had a psychological impact on the mother. What advice would you give to such? Joshua, would you like to please take this question?
Sorry, can we go over the question again one more time? No. Can you hear me?
Yes, sorry, I had just gone out of the chat. Let me find it again. It was asking about, I have a niece who has sickle cell disease and she has been in and out of the hospital. This has had a psychological impact on the mother. What advice would you give to such a person?
Like I said, I would have to agree with Miss Clara. Mrs. I'm not too sure, sorry. Finding a support system and who to talk to is very important. Knowing who to talk to, knowing who can provide help is very important. I feel like the toll that sickle cell disease takes on the patient not only affects the patient, but also the family members, that's the caregivers. So in this case, the mom should also try and seek professional help. Thank you.
Yes, thank you very much for sharing that. Solange, your hand is up. Would you like to add something? Hi, Solange, your hand is up. And Samuel, your hand is up as well. You can go ahead and speak.
Okay, so for families with children with chronic illnesses, from my experience personally and also from my experience as a doctor seeing patients, is that it is quite difficult on family members to see their loved ones suffering. And so the doctors need to address both the concerns of the patient and the concerns of the family members. So that is important for the doctor to sit down with the mom and explain what's going on, explain how they're trying to help and what to expect. And then also the worry from the family members tends to also make the situation for the patient a bit worse. Obviously, if you're struggling with something and you know it causes harm to your family, that makes you worry even more. And patients have this desire to go home and prove that they're fine when they aren't fine. And so doctors and whoever is assisting they need to be clear when they speak to both the family and both to the patient that there is a process. We're on this stage of this process. You can expect this. Patient will go through this, go through that, but they will be fine. And that should calm the nerves of both the mother and the daughter.
Thank you for adding that, Samuel. And I suppose you would be best versed to answer the next question from Emanuela as well, being a warrior and a doctor. She's asking, why is it that sickle cell patients tend to die before their time?
A quick one. Before we go on, I wanted to add something to the previous question, if that's okay. I
Sure,
have my hand raised. Yeah. So what I was trying to say is, I just wanted to add a bit to that, and I feel like a parent with a sickle cell warrior should also be more educated about sickle cell, and also maybe they should find out what actually triggers the sickle cell crisis and what is taking the child in and out of the hospital. Because in most cases, parents do not really understand what sickle cell is, because I've witnessed situations where there was two parents that had two kids with sickle cell, and whenever like they're starting to have crisis, they'll set them in the sun to warm them up and all that, which kind of make it worse. So the parents of the warrior should also be educated more on sickle cell, so that they would understand it better and they can help avoid more ins and outs, and what can help, like maybe getting on hydria, getting hydrated and all that, to help prevent the in and out of going into crisis as possible as it could be.
Thank you so much. Thank you for your addition.
Oh, sorry, may I ask something?
Sure, go ahead.
Oh, thank you very much. It's also about the previous one about the parent, and I think it will also help about the discrimination part. So when someone is suffering emotionally, it has a mental reason. And usually when a parent or anyone is going through this emotional pain, suffering, they don't know what is this suffering. They cannot name it. They cannot say, the feeling is guilt, the feeling is sadness, the feeling is fear, the feeling is despair. So one of the first things will be to be able to create this self-awareness about what is the feeling that drag someone down. What is the mental reason? What is the thought behind this feeling? And when those two things are discovered, now we have a leverage to transform it and go from a place of resistance to a place of acceptance and even grace, because we have the possibility to transform something that is painful. It's something that is actually constructive, but it all starts with self-awareness. This is why having a professional that helps you with this self-awareness work is very important, because you discover yourself, you straighten yourself, and with this inner strength, and you're very solid in your roots, now you can change the emotional state that you're in, so you can have more power to face those situations that you have to go through. And this point that I'm making is true for the parents, but it will also be true with someone facing the discrimination, as we have seen before. The problem that you have with discrimination, is it that you feel ashamed? Is it that you wonder if it's not true? So this is shame, actually. Is it because you feel fearful? What is the emotion? And how can you untangle the fear? By creating the antidote from your mind to face this fear and deconstruct this fear if it's fear, this shame if it's fear, this guilt if it's guilt. For parents, very often there is guilt because they feel responsible about the fact that there is the disease, and on top of that there is the fear. So how can you go from guilt and fear to feeling hopeful, creating acceptance, and feeling grateful? And this is a mental work that you can do with professionals, and it's extremely powerful. Everyone has the resources to do that. We just need to dig a little bit inside ourselves.
Thank you so much for all these amazing responses. I think you've all given such practical advice and things that people can easily apply. Next, Eseza, you also have your hand up. Did you want to add something?
Hi, thanks, Kambe. So I wanted to, I hope you can hear me. So I wanted to add an answer to the question by Emanuela, why is it that sickle cell patients die before their time? As a sickle cell patient, I think I spoke to a friend about this, where I say that sometimes I think as patients, we die of heartbreak, which is also like an emotional break. When you're in the depths of a crisis, your 100th crisis, and it just weighs down mentally on you, apart from the physical turmoil that you're going through and everything. But when you do not have the proper support and someone to lean on and cry to, someone to advocate for you and make you feel like this life is worth it. While in a crisis, I think it's very easy to give up and just embrace death, as morbid as that sounds. And I think, so something I do that I volunteer doing is being a birthing doula, where, and I'm going to tie this in just now, where I work with pregnant women or mothers who are giving birth, where, you know how women who've given birth, it's a grueling experience. It's difficult on the mind and the body. And I'm up here while the midwife or the doctor's down there taking care of the baby. I'm up here pushing the mother, channeling her strength, telling her how amazing she is, that she can do it. And at the end, they'll be like, oh my gosh, I didn't know I had that strength. And I think we need something that I think we'd call an illness doula, someone who'd come in hospital, go to the hematology ward, and find people in crisis or anyone who's sick, really, and just help them through that crisis. It can be especially if it's another sickle cell patient, it can be such a horribly gosh, I don't know what the word is. It's making me a bit emotional. It's a horrible time. Like going through the worst crisis of your life is traumatizing. And to have someone who's been through it, because also as a birthing doula, you have to have had babies for you to understand what the other woman's going through. To have someone advocating for you, telling you you can do it, someone who totally understands the pain you're going through, I think that would help mentally and help push people to work their way out of a crisis. And I think we can avoid many premature deaths that way. I wonder if it's something that the different support groups can work on. Because with the birthing doulas, with the mothers, we've seen many positive birthing experiences where women come out feeling empowered. And maybe this is something that would help sickle cell warriors when they come out of a crisis, not feeling traumatized, but feeling empowered that, okay, I could do that. I am strong enough. And maybe that will lessen the trauma and lessen the mental strain on the different warriors and hopefully lengthen the amount of time we're here on Earth. Thank you.
Thanks, Cesar. That's really an interesting concept, and not one that is too far away. That's something that, especially as patient representative groups, perhaps it's something that can be spoken about. And even if it's in terms of like a mentorship program and, you have somebody that you can call. So looking forward to hearing more about that on a future webinar. Joshua, your hand is up. And then after that, we'll go to Samuel and then to Nabila.
The persons who said they're facing discrimination at work, I just wanted to add in something. It's a word of encouragement per se. People fear what they do not understand. You shouldn't feel bad because of the situation. However they react is a reflection of their own ignorance, and that's why creating awareness is very important and let people understand what these warriors go through. Because I've spoken and I've had sessions with various patients, and I've heard what they've said. These people go to places so dark that you can't even imagine. It makes me emotional sometimes. So don't let it weigh you down. It's a reflection of their own ignorance. Thank you. That's what I want to say.
Thank you so much for sharing that, Joshua. Thank you. Next, we're going to Sam.
I want to touch on what you guys said earlier about the support. I've had quite a number of crises, throughout my life, and I've never been alone in any of them. My very first one, my mom was in my room, and every subsequent one, I've had either a best friend there or my aunt. And my one this year, my aunt was there, and she was on the phone with me. She's far away, couldn't do anything but on the phone for an hour and just were quiet, and that support helped a lot tremendously. And there is significant evidence that patients that lose hope, or patients that, you know, lose that fire to, you know, that will to live, they die, especially in surgery before they go for operations. If they believe they're going to die, they won't make it. Most of them really don't do well afterwards. And it's something that is lacking in the adult side of medicine. In the ped side, it's there where you tell the young boy, you tell the young girl that, well done, you're so strong, you distract them from what's going on, and you encourage them. And they're children, like they're living according to their base and instincts, like they aren't clouded by these, like logical thoughts and feelings and so forth. And as a patient, you have that same innate, desire to be encouraged, same innate desire to be, shown love and, be told you can do it. And it's hard for a patient to say, hey, please encourage me, I've never heard a patient say that though, but they do appreciate it when you do encourage them. And so that's actually something we should look into. Definitely having someone go around just to check up on, the different patients in different wards, especially diabetes and the stuff that really affects your lifestyle drastically. Those patients need to be, encouraged. And then to answer the question about why sickle cell patients die prematurely, it's much, much better now than it was in the past. There has been quite a number of breakthroughs, and there's a lot of medications like hydroxyurea, which is a lot more widely available. So the occurrence of death prematurely isn't as bad. Most patients do die from, at a very young age, from acute chest syndrome. Basically, it's like I don't know, I could say pneumonia. It's a very bad way to explain it though. But they die from that. Others die from renal failure, others die from stroke. Obviously, the clots form, they're very hypercoagulable, and those clots can form, damage the kidneys, damage the brain, damage the heart, and you can have complications. But like I said, please don't be afraid of that, because we have such massive, advancements in medication that can help you along your journey, even with support structures, with support systems. Like, you can live a normal, healthy life with sickle cell anemia as long as you take care of yourself and you monitor the triggers and you pace yourself.
Thank you so much, Samuel. Again, you raised some things similar to what Eseza mentioned. So hopefully one day we'll hear back from you both on, some way that we found to better support our warriors in the ward. Next, we'll go to Nabila, and after Nabila, we'll go to Marlon.
Thanks, Dr. Kambe. My comment also ties into Samuel and Isiza. So I just did my research on exploring the experiences of adult patients when they visit the emergency units in South African hospitals. And one of the themes were the psychological impact on the patients during their hospital visits. And it was the add-on effect of illness uncertainty, never knowing what their body is going to throw on them every day when they wake up, plus now going to the emergency unit, not knowing, will the doctors believe them? Will they believe their pain? How long will they be admitted for? How many days will they miss from work? And in some cases, it was, okay, that environment triggers memories from past experiences, whether it was being bullied at school or whether it was a bad experience in hospital. It was also a place where they knew other sickle cell warriors had passed away, that caused this distress in them. And they also suggested having a support person with them because the pain is so debilitating that they can't speak for themselves. And while they're in the hospital environment, the factors of the hospital also escalates the crisis. Sometimes it's the temperature or the noise. And when I did my research, I found that for cancer patients, they have a champion oncology nurse. That's someone that motivates these patients to get through the chemo and get through their sessions. And so apart from having a support person, whether it's a loved ones with them, having, healthcare workers that are passionate and invested in patients' recovery can also help. And it's also so sad, you know, being a part of the sickle cell support group, when we have new parents that are referred to the support group, and we get in touch and we call them, the first question that a parent will ask is, how old are you? And most often in other African countries, these children are still passing away by the age of 7. And that's what they tell you. And that's what they know. And sometimes in genetic counseling, if we're doing a family history, and this person is now in South Africa and they have family with sickle cell in South Africa, but they have a family in another African country, sometimes you can see, you know, these children have passed away, whereas now they having in South Africa, they have access to better care, and they grow to their teens. So I think it's education, empowerment, knowledge. You know, it's all like a multifaceted. It all links together and ties together, and getting access to treatment in these other countries is so important. The last thing I want to add is for patients and their caregivers, there's the saying that says, you're not a burden, you're carrying a burden. Just to remember that and know that asking for help is a strength, it's not a weakness. And the better you can communicate your needs and allow people to help, because there's so many people that are willing to help, but we all need that help differently. If you can communicate, it can take such a load off. And even in those times of crisis, if you're feeling so overwhelmed and you can't talk to anyone, just have like a one-liner ready to say, you know, I'm going through a crisis, I'm overwhelmed, I'm figuring it out, but I'll talk to you when I need, or just to let people know the space you're in, but also take that pressure off where you don't have that expectations on yourself, because there's something about sickle cell warriors and they need to be everything and do everything that also gets the better of us.
Thank you so much, Nabila. And thank you. That's a really good quote about not being a burden, but carrying a burden, because the two things are really different. And also, thank you so much for sharing your work. It's really interesting. And I hope that there's an opportunity for us all in the future where we can hear more about it and in more detail. Next, we'd like to go to Mollen, please. And if Marlon isn't here, I'd like to go ask Jean-Pierre to take over for this last part.
Thank you, Kambe, and thank you to all who have participated in giving quite profound answers to a lot of questions that people have been carrying or burdened with. So at this point, we're almost towards the end of our webinar. A lot has been shared today, a lot has been covered, and I feel it gives us this feeling that we still have a lot more to do. But before we part ways, I just want to quickly call upon our speakers to sort of tell us where we go from here. Just in a few words, speakers, what would you say is our call to action after today's webinar? I'll start with Mr. Joshua, then we can go to Aliu, Sam, and we'll close off with Clara. Joshua, Mr. Joshua, are you there?
Yeah, I'm here. Okay.
Okay, so in
everyone. Like I said earlier, in the last part of my slides, I said providing psychological services is important, but for the warriors, caregivers, spouses, parents, everyone in general, and a more holistic approach to healthcare in Africa is very, 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 very important, because oftentimes the mental health of the individual is often neglected. Thank you.
Thank you, Joshua. Mr. Aliu, in a few words, what is our call to action after today? Mr. Aliu, are you there? While we're waiting for Mr. Aliu, Dr. Sam, can you just quickly jump in and give us our call to action?
Okay, my call to action will still be to other warriors. I know it's difficult. The pain is undeniably true. I always describe the pain as what you would feel if you're doing like leg presses or squats or ab exercises, you know, that burning, sharp pain, and you just can't turn it off, but it's in your bones. And it really does make you want to quit. And it's hard when it happens over and over and over and over and over again. But life is truly about perspective. And as hard as it is, I really want you all to try your best to see things as optimally as possible. It's difficult. You can go to counseling, you can speak to your family members, but whatever it takes, please don't become nihilistic. Don't become disheartened. Like I said, emotions, you know, they're there, but you know, they can leave as well. So that would be my call to action to every single warrior here is just don't lose heart, and yeah, you'll be fine.
Thank you, Dr. Sam. I think Aliu is available now. Aliu, you can go through.
Okay, Jean-Pierre, thank you so much. My last words will be to not to procrastinate, think positive, don't quit, and then break the silence. There's nothing that we can't overcome. You know, nothing is impossible, and everything is possible. So think positive, and then be hopeful. There is life um, afterwards. Thank you.
Thank you. So I'll just like to say thank you to everyone who's made it possible to be here. And our next webinar is on Thursday, April 30th, about a month from now.
Sorry, guys. Sorry, my apologies. Can I just contribute for a minute? I just wanted to say something that has really helped me get by every day was palliative care. I have a team of doctors that consists of counselors and my hematologists and other doctors that are in different specialties that help me go through each day. Palliative care does not have to start when things get so bad, and it has to start on the diagnosis itself. And you have to be strategic about it and try and find a way in which is so comfortable for the patient to live a life that is strategic and meaningful. No matter how difficult it gets, each day needs to be strategically placed. It has to be meaningful so that they don't lose hope. Thank you. That's just what I wanted to say.
Thanks, Moline. I will quickly open the floor to Clara to give us a few words before we close off. Clara.
Thanks a lot. My call to action would be to find your person, to join forces, because in time of crisis, that is very essential. Also to break the taboo. Everyone is the same. The feeling, the struggles, the heartbreak that you're going through, someone else is going through it at this very moment in the meantime of you. So don't be ashamed and just reach out to people that can help, that can sometimes just be a presence, because the world needs you. That will be my, I would say my sentence for people living with sickle cell. You're not a burden, you're a gift to this world. You have a lot to add. You have a lot to bring, to teach. But for this, you need to be there. And so mainly just break the silence and trust this strength inside you.
Thank you, Clara, for that. So on behalf of my co-moderator, Kambe, I would like to express our sincere gratitude to our speakers for their incredible, insightful presentations and for generously sharing their personal stories with us. They were quite vulnerable in that aspect and a lot to take from that. Thank you for letting us into your space. Our heartfelt thanks to the SickleInAfrica Data Coordinating Center and to the patient as partners in Sickle Cell Disease Research Working Group for providing us with this platform to have this important conversation. And it just leads us into having more and more conversations. So our next webinar will be on Tuesday, 30th April, about a month from now. It will be a continuation of today's discussions, and we'll bring together various stakeholders to collaboratively map out a call to action for addressing psychosocial distress in patients living with sickle cell disease and their caregivers. We eagerly anticipate your participation in the next webinar. Thank you for attending today's webinar. If it's your first time coming across this webinar or you're a regular, please stay well and take care. Spread what we're doing here. Reach out to others. Be a brother's keeper. Thank you so much from all of us here. Thank you and have a good night, a great day wherever you are, depending on the timeline. Thank you so much, everyone.
Thank you.
Thank you, guys.